I guess I shouldn't probably use the
Here's
word
to
tackle
your
when I'm
health
talking with
is
physical
presented
therapists
by
because-
American
or maybe I
Medical
should,
Center.
because that's the area where the two gentlemen joining me this morning, that is their wheelhouse. We have Dr. Luan Nguyen and Dr. Leonard Campus with NewGen Physical Therapy. Gentlemen, so good to see you, and welcome to the show. We're very happy to be working with you guys.
Thank you for
thanks for
having
having
us.
us.
All right, good to see. Like you can never know too many Guam doctors, and especially when it comes to physical therapy, which I assume, gentlemen, your work maybe took or did it even take like a little bit of a dip because of the pandemic? But I assume now with school coming back, everybody's asking about like what's going on with sports. People may have been very sedentary over the last 10 months and everything like that. I'm assuming, and in a certain deal, I'm hoping that actually your workload picks back up again.
Yeah, we definitely took a little dip in services over the year. There wasn't as many elective surgeries for things like ACL repair, shoulder surgeries, knee surgeries. Not as many injuries in sports since there weren't as much sports. But we did see an uptake in some other sedentary type causes for pain. But yeah, definitely the physical therapy was affected. We were able to mitigate that a little with telehealth, which was okay on the island, and allowed us just to at least provide services to our clients. Mm-hmm. But yeah, we were just trying to get through the year and try to chug through and get to this year and try to make a good comeback or a rebound.
All right. And Dr. Nguyen, you guys are actually located in Tamuning next to another organization that we're very, very familiar with over at Steel Athletics. So, congratulations on the digs. That's a great place to be, so close to the hospital and, very centrally located for people in need of your services.
Great. Thank you very much. It was very kind of humble beginnings where we just started with just maybe about four people. It was just myself, Dr. Campus, my wife, and Janae and Justin, and just with trying to fill the need of physical therapy. But we certainly evolved over the last 4 years. And, personally at American Medical Center, after seeing thousands of patients, I just started to see a lot of the connection between chronic illness and just joint disease where, I would say 80 to 90% of the patients that walk through NewGen typically get better, but we noticed that some patients quite didn't progress as well because of some of the lifestyle things. So with that in mind, we added, involved different services, and we've added a health coach to really work on the nutrition aspects, to have a more anti-inflammatory diet, to really look at stress and chronic stress and management of that, and trying to put all that together to have better results. And that's kind of in the more direction we've added to our services.
That's interesting. You would diversify in that way, because I know most people, I know I've thought of, as a patient and as someone who has brought, my late father and also my mom, because my mom dealt with sciatica for the better part of about a year and a half. And so she went through physical therapy. I wouldn't naturally make the connection between, okay, if I need like a wellness coach, or, someone with within the scope of dietitian and everything like that, they would go to a physical therapy, outlet. But that is pretty cool how you kind of offer that one-stop shopping now.
Right.
Yeah, we really believe in a collaborative approach, and in medicine, that's shown to work the best when your medical doctors work with your physical therapist, work with your dietitian, work with your nutritionist. So we're really creating a team to put behind our clients. So it was a no-brainer for us to bring in the health and wellness side with the health coaching. It just supplements our medical care and our physical therapy care we provide. So our clients get the best outcomes.
Now, Dr. Campos, I like the fact that I shouldn't say I like the fact that you said there's a lot of ACL tears and things like that. As a former athlete and everything, that scared the heck out of me, right? Whenever somebody says ACL, those are the 3 scariest letters you ever want to mention to a volleyball player, right? But with the return to sports, and Guam is such a sports-loving community. I know that we've talked to coaches and people with the ISA and IIAAG, and they said we want to make sure that when student athletes get back into the competitive spirit, everyone just wants to jump back on the field, get back on the court. But these are kids who, even if they were getting a little bit of exercise, they're not in like game ready shape and everything like that. So what are you anticipating maybe about some of the concerns that might come your way, or, as we begin to get more and more into slowly inch back into competitive sports, things like maybe, twisted ankles or, slight sprains and things like that. What are you anticipating?
Yeah, we really recommend people do a pretty good strength and conditioning and try to get back into their programs as early as they can. Tendon loading and all that has a big impact. And with a year off from play, it does make people more prone to those types of injuries. So recommend people get back out there, put some load on their body, do some jumping, some running. We don't want to see all those ACL tears and meniscus injuries in the office. That's why we have a pretty in-depth preseason program where we get our kids, primarily our kids, ready for sports play by strength and conditioning and getting their body loaded. So that way, when they're going to play, it's not such a big increase in the loading, which usually results in these injuries. So we really recommend that to everyone. Get out there prior to season, prior to play, and put the time in. It'll only make them better during season.
Now, on the opposite side of the spectrum, Dr. Nguyen, are a lot of your clientele like more on the side of maybe some of our islands like elderly, or people that have had maybe like osteoporosis issues, or even maybe like post-op that need that kind of like care to get them back to to like a normal state of health if they've been through some sort of traumatic event?
Certainly, yeah, I do have a lot of chronic lifestyle management type patients, and that's where I really try to push for kind of making that connection between how key your lifestyle choices, what you do on a day-to-day basis, affect your joints, just even the pain level. Because it's interesting how you can get two different patients where, on the X-ray they both have bone-to-bone, joint arthritis on the X-ray, but they can have two different outcomes where one's walking, running fine, and the other one's in chronic pain. And just that factor is just the lifestyle things, just the nutrition, how much they exercise, even just how their optimism versus pessimism, all those kind of attitudes and things make a big difference in terms of the pain levels and outcomes they have in their life. And just the kind of, to scope on the outer side or the, I guess, elderly, I guess on the elderly side, I'm 40 right now. And my own personal goal is to play tennis past the 100 and to get a world ranking on the senior tour. So I want to be able to give that quality of life. I noticed that, treating, thousands and thousands of patients, that we've had great technology, medications, and being able to put stents and all kinds of things to prolong the life, but our quality of life is not necessarily much better. So I want to really emphasize the fact of how can we improve our quality of life and how can we do the things that we used to love into our life.
Hey, well, if you ever fly down, because as I understand it, there's a pretty big tennis tournament going down in down under right now. So if you ever want to fly down and take on Rafael Nadal, give us a ring and everything. We'll be sure to cover that for you.
I might have a chance when I'm 80 and the physical therapists are keeping me in shape.
There you go. Hey, we'll keep you have a KUM promise. We'll cover that for you.
Remember, the saying is motion is lotion. So if you keep moving, keep active, it'll keep all those joints nice and healthy, as opposed to being sedentary. And then all those arthritic pains start to become a problem for people. So recommend people, stay active, get their daily activity in. I think the World Health Organization recommends about 150 minutes a week. So we want to really promote that and get people moving so they can stay healthy longer.
Good tip. Motion is lotion. I like that. So maybe if both of you gentlemen can, maybe take us through the average day of a physical therapist on Guam in terms of like the number and the breadth of the cases that you see, and maybe just like, what your work day is like as far as, maybe like doing assessments, doing referrals, and then actually dealing with patients and maybe doing research.
Okay, so yeah, we got how many people we see can vary quite a bit from setting to setting. We tend to keep our patients to about 6 to 8 a day per therapist. That way we give quite a long amount of time for each clinician to spend with each client. I think that's what separates us, is putting the time in with the client. So we see about 8, somewhere between 6 and 9. Usually we'll come in, and the way I like to do it is I like to start by talking with our clients, figuring out what's going on, what worked good for them last time. It's a continual problem solving task where we're listening to the needs, and then we're trying to create a solution or see if it fits in our plan for how we're going to work with those problems or those identified issues. Mm-hmm. So we'll spend quite a few minutes talking with the clients, and then we'll get to moving. I like to place hands and try to see if there's anything I can do personally with every client to make them feel better. Once we get their pain down, we can have them do all kinds of things, all kinds of exercises. So we really believe in using our manual techniques to unlock more activities in a physical and exercise route. And then that way we can overall better them. anyone can make someone feel good with a massage. That relief of pain is fleeting and lasts for only a little bit. The exercise is where we get the long-term results. So we use the hand things to get them feeling good and get the buy-in, and then we work them with exercise to make the long plan happen for them.
Well, of course, with our audience
talking.
here, if you offer a quality massage to any Guamanian, you know, whether you've lived here for 2 weeks or, you know, 20 years and everything like that, you'd have to be a fool to turn that down.
Yeah, we get quite a people in here asking for massages, and we do give them out, but we always have a lot of exercise on the other side of that. So that way, we're not just making people feel better in a fleeting moment, but getting them better overall. We always thinking about how to discharge someone. So we want to get them better so we can do that. And then we say, if you want to come back to us for something else, we're more than likely to see that. But we definitely want to resolve the issues you came to us for.
Mm-hmm. Okay, Dr. Nguyen, what's your average day like?
Average day, generally at 8 to 5, see about 20, 25 patients a day. And a lot of my patients deal with really counseling, actually, just talking to them about how to reverse diabetes, how to improve their chronic conditions. Because the number one rule of longevity is avoid, the big killers, right? Like the heart disease, the strokes, diabetes, and that's kind of the biggest battle of how to reverse those things, to avoid hospitalizations and things. So a lot of my time is spent counseling and talking about nutrition and exercise and things along with medications.
Mm-hmm. Okay, so final question to both of you gentlemen. And again, I come back to the fact that Guam is such a sports-rich, sports-loving community. For athletes out there, at any level, we may be on the national team, high school, middle school, pickup clubs, or you just go to your village gym and play. For people with that mentality, their body is their main asset and everything. And even if they haven't had a debilitating injury, or even if they don't have a condition about themselves which may prove to be more problematic down the line, what services can you provide that they can say, hey, I'm doing really well right now, I'm competing, I take care of myself, but I want to keep myself in tip-top shape, so I can go see the folks at NewGen and everything like that, and they can make sure that I'm in top competitive form?
Well, we do offer lots of different types of testing for return to play, and to make sure someone is ready to play, that they have a lower likelihood of injury. But we have a lot of other things, from the health coaching, nutrition coaching, things like that. But we also offer various forms of exercise, from our personal training with our strength and conditioning coaches, to even aquatics, where we can put someone in the pool. We reduce impact to the joints, but we can still strengthen them up. So we're the only place on Guam that's offering the aquatic therapy in that fashion. So we've tried to create an army over here that can provide any physical therapy or health or wellness needs. And we've been slowly assembling our pieces to create a very comprehensive plan. So I think what you get here is a team that has a lot of resources to put behind you to keep our athletes playing, to keep them healthy, and to make them succeed. All
right, Dr. Nguyen, you have the final word.
Just a final plug, kind of related to the health and wellness side, is we do have a program where we consider weight management, but I really looking at it in perspective of how to reverse diabetes and your chronic illnesses. But it's a weight management program with Aetna and NetCare, and it's a 3-month program. So you work between me, and I mainly order a lot of the labs to kind of assess the progress, and then you also work with a health coach. And it's a 3-month program. You just pay about $175 as a deposit, but you get that back at the end of the program. So it's essentially free if you're able to make that deposit once you complete. So I'm excited, and we've been having great results. We've had as much as 50 pounds weight loss. We've had people get off medications, or from diabetic to non-diabetic. So it's been an exciting program, and we're trying to really build that and help the community that way. So that, and also to touch upon Dr. Campus, we do also have a sports performance program where the physical therapist works with the personal trainer. So we do have a lot of the national tennis players that have gone through our program, and we're trying to expand that to help that into soccer and basketball, other sports as well.
All right, well, gents, that's all the time we have for today, but it was a really delight working with the both of you. And this is just the tip of the iceberg, because what we're going to come in the coming weeks and everything like that, we hope to pass more information on to the community, educate people about the services that you're always able to provide, and send a lot of business your way, because you guys are doing a lot of really good work. So congratulations for being back in the office, and we wish you both the best, and thank you for what you do for our community.
Yeah, we invite everybody to come down and see our new office. We're over here at the KG Plaza, right next to Steel, and where the old Kotoras and Micropack. So we're over here. We create a beautiful environment for people to get well. Shout outs to Guam Real Estate Agent for setting us up. But come by, see the place. Our house is your house.
All right, can't wait. Maybe next week we'll do some stretching exercises. Like we'll do an interactive thing over Zoom, and everybody watching can participate. We'll all make sure that we're in tip-top shape with physical therapy. Thank you, gentlemen.
Sounds good. Thanks for having us on.
All right, have a good day. And we will see them next week. And Sabrina Salix Mata, look what the cat dragged in. She is here right now. Good morning, Bree.
Hafa day, everybody. Good morning. We do have an update to that developing story that we brought you last night regarding a missing spirit.